American Public Square's Civics Education Initiative is a year-long project-based learning opportunity for area high school students that supplements the civic instruction that they get through their state curriculum.
Part of our mission at American Public Square means that we are hoping to support educators and young people as we think about tackling the polarization that we have been suffering from in our communities and country.
The mission of APS Civics Education Initiative, all the civil dialogue training, the lessons, and the opportunity to sort of practice that in a real-world setting has been really good for our students and aligns really well with what I'm trying to do in the classroom.
Our Civics Education Initiative is broken into two components. The first semester focuses on in-classroom curriculum that covers issues such as identifying misinformation, disinformation, and bias, and identifying tools and tricks for how you can disagree better. The second semester is focused on an active project-based learning opportunity where students come together across the different schools to build their own APS-style signature event.
At the start, we had lots of different opinions, lots of different topics that we wanted to cover, and we finally narrowed it down to gun restrictions, gun violence.
It was great seeing other students' perspective of gun violence. It really helped me be open-minded, not just closed in my own thoughts, but trying to see why they think the way they do.
The next process we had was a lot of research. We looked at people who we thought would not only be influential, but have both sides accurately represented.
I think the process has been very interactive and based on teamwork. So I'm excited to just advertise it and have people show up and see the hard work that we've put into it.
On behalf of all the APS student ambassadors, I welcome you and thank you for spending the evening with us.
We chose gun violence because of its prevalence in our society and lives. We can all agree that gun violence is a negative issue with poor consequences, although we all go about solving this problem differently.
When it comes to the Second Amendment, we'll just be honest, we can't take all the guns. But we focus so much on the tool that is being used rather than all of the other pieces, like you just said, that go along with why someone chooses violence.
I agree that we're not going to get rid of the guns, but there are also laws that are still kind of polarizing sometimes that are effective, like extreme risk protection order laws.
One of the reasons why it's so important that we have such an interdisciplinary group here is that we have to invest ourselves in this multifaceted problem if we want to fix it. And I'm so excited about the students working on this because that makes me feel really, really hopeful. I think there are people in this room that are going to really be part of all the answers we need to address this problem.
We hope that from here, our 2023-2024 cohort has the skills to not only tolerate, but to seek out the perspective that is unknown to them.
From APS, I've definitely built a lot of conversation skills, and I feel better about being able to format and explain my ideas properly and in a respectful and professional manner.
I now realize it's so important to look things up yourself and not only from just one source, but multiple sources that are trusted.
I think a lot of times kids, they go into difficult topics with the oh, well, it's okay to agree to disagree. And then we can just if we get to a point where there's tension, we can just back away and leave it. And I really try, and I think APS does a good job helping me with this, try to push beyond that.
Engaging with people that you don't agree with can be some of the most formative experiences of your life. And if you understand that, you recognize the value of that as a young person today, that's what we're hoping our high school students come away from this program having internalized. That makes for a richer life experience and a healthier, thriving ecosystem and democracy.
Hello, my name is Eric. I am a junior at University Academy. Through my school, I participated in the Civic Education Initiative for the American Public Square. During one of the sessions, I talked to many committed community leaders who joined our work day to share about their work and intersect with homelessness. One leader, Jill Smith, stood out to me. She is a community leader at the outdoor soup kitchen who helps cater that food for unhoused people. When she was talking to my group, she kept a smile on her face and seemed really happy to talk about helping the unhoused. But when I found out she was unhoused herself previously, I became curious. I kept thinking, how does she keep her mental health together throughout everything she does? When she has been through it herself, does it bring back memories? Does she have mental health problems? Participating as a student ambassador with APS this year increased my curiosity about a lot of things, including my community and those who lead it. Programs like this help students feel like they have a voice in issues we face and a responsibility to be informed, engaged, and seek perspective from many different people. In fact, I was inspired to write an op-ed titled Taking Care of the Mental Health of Leaders Who Help the Homelessness. You can find my op-ed in the KC Star and an op-ed on the program event page at APS website. On behalf of all the student ambassadors from the 2024-2025 cohort, I want to thank the many community leaders, journalists, government officials, and all those who supported our year-long project. We are excited to bring this very important conversation to you this evening.
Hi, my name is Zoe, and I'm a junior from Belton High School.
Hi, I'm Matthew, a senior from the Ewing Marion Kaufman School.
We hope our program will be a model to encourage more of us to engage in civil dialogue about homelessness and other polarizing topics so that we may work together to build a less contentious, safer, and more productive society. There is no question, regardless of political persuasion, everyone wants to see far less homelessness. However, our panelists arrive at this conversation with varied and complex experiences with this topic. Their diverse views on the solutions to homelessness mirror their range within our broader APS community.
This program is a chance for us to come together, look beyond our closely held positions for the evening, listen to different perspectives, and seek to better understand each other's experiences and begin to navigate a path forward for the students across the region, for our community leaders, for community members experiencing homelessness, and for the broader Kansas City community.
Hi, I'm Elisa from University Academy High School, and before we begin the conversation in earnest, I want to recognize the schools and educators who made this year's Civic Education Initiative possible. Without their partnership and efforts, we would not be gathered here today. After I have read all their names, join me in a big round of applause. Dr. Leah Edens from University Academy, Robert Flynn from St. Teresa's Academy, Joni Harrell from Belton, Dr. Carrie Marcantonio, Barnett Thompson from Shawnee Mission North, Brent Schulte from Olathe North, Keith Schoen from Guadalupe Centers High School, and Ellen Clayton from Ewing Marion Kaufman School. Please join me in a round of applause for our partners and teachers everywhere.
Hello everyone, my name is Aldo. I am a senior from Guadalupe Centers High School. If we have done our job at producing an interesting program on this complex topic, you'll hear something you agree with and something that challenges your positions. APS founder Ambassador Katz often says ahead of programs, tonight, if you hear something you agree with, we encourage you to shake your head yes. If you hear something you disagree with, we encourage you to shake your head no. Students will be providing more information on an APS Ability Toolkit, which will help guide not only our panelists' remarks, but your participation too.
Great job.
I'm Annie from Shawnee Mission North.
And I'm Abigail Bixler, a current junior at Liberty High School.
John Stuart Mills is known to have said, "He who knows only his own side of the case knows little of that."
And Bill Nye the Science Guy once said, "Everyone you will ever meet knows something that you don't."
On behalf of the APS student ambassadors, we welcome you and thank you for spending the evening with us. Tonight's program is the accumulation of our work together over the course of the school year. We want to thank our parents, teachers, and school administrators who have cooperated to make our engagement possible. It is a great example of school communities tackling big problems, encouraging students to foster critical thinking and working together to produce great things.
We also want to encourage you to attend an upcoming sponsored documentary screening and panel called Beyond the Bridge on May 7th at Independence Boulevard Christian Church. Although we met with people with experiencing homelessness during our research, we want to acknowledge that we do not have a panelist to represent that voice tonight. However, the film screening will include voices of lived experiences, and we hope you will keep the conversation going by attending.
Hello, I am Kendall from St. Teresa's Academy. As always, during American Public Square programming, we welcome questions and fact checks from the audience. For our audience members in person, you will see question and fact check cards around the stadium. They look just like this. And when you have a question or fact check, please write it on your card and hold it up. A student volunteer will come around and collect it for our roving reporter and fact checking team sitting right here in the front. Tonight's roving reporter is Laura Bayer with the Kansas City Star, and our fact checker is Leah Winkham, an editor at the Johnson County Community Post. Both are supported by that team of students. For those of you watching virtually, please type your questions or fact checks in the chat feature. Comments in the chat will be monitored. Please note, we will likely not be able to ask the panel all of the questions the live and virtual audience will ask. Our roving reporter and team will do their best to pull out themes. We hope you had a chance to review the fact sheet. You can find it along with the related sources and citations on the events page at americanpublicsquare.org.
At American Public Square, we rely on our civility toolkit to keep our conversation on track and civil. Please take a moment to review the toolkit featured here. Several members of the audience have civility bells. These will be rung if the tone of the conversation becomes less than civil and needs to be redirected. Finally, in the interest of keeping the conversation flowing and of course civil, we ask that you not clap during the program. The bells may also ring if the audience needs a reminder. It is now my privilege to introduce our moderator for the evening, Chris Green, Executive Editor for the Journal.
Thank you, and thank you to the students for that great introduction. Delighted to be coming up here from Wichita and the Kansas Leadership Center and our publication, The Journal, and looking forward to a great conversation. I'm going to introduce our panel. Starting directly to my right, we have Anna Bailey, Senior Policy Analyst at the Center on Budget and Policy Priorities, CBPP, a nonpartisan research and policy institute. We have Joss Hinges, Homeless Prevention Coordinator from the city of Kansas City, Missouri. We have Stephanie Boyer, the CEO of Restart, a local organization dedicated to ending homelessness. And finally, on the far right, your left, is Paul Webster, Executive Director of the LA Alliance for Human Rights and Visiting Fellow at the Cicero Institute, a nonpartisan advocacy organization for state-level policies. So as I was thinking about starting this conversation, I had a kind of decision to make about, do we start talking about this at the national level, or do we start talking about this about a Kansas City issue? And maybe it doesn't matter. The title of this program is Homelessness, a Neglected Epidemic, which suggests to me that this is a problem, and not just like a problem, but a really big problem, but also one that's not getting enough of something, either our attention or our resources. The title suggests that we're not where we want to be advancing on this problem. And I started to think, well, what is the problem? And so that's where I'd like to start with this panel, and starting with Anna. When we talk about homelessness, what is the problem we should be talking about? What are we trying to capture through the title of this program?
Well, thank you for the opportunity to kick the conversation off. This feels like a really important moment to see so many people in the audience, and I want to thank the students for picking this topic, for bringing us up here to share what we know, and to hopefully initiate a conversation that you all continue after today. When I think about what is at the root of the problem of homelessness, it's quite simple. It's that people can't afford a place to live or can't find a place that they can afford to live. And so the driving factor there is that people's incomes aren't high enough to pay high rents, and rents are too high. So it's sort of two sides of the same coin. And we need to address both sides of that coin. So just to help you understand the scale of the problem, we have an estimate of over 770,000 individuals experiencing homelessness on a given night last year. And that's a big number in this country. But an even bigger number is that we have 23 million people in low-income households who are paying more than half their rent, half their income on rent every month. So homelessness is a part of this bigger problem that housing isn't affordable, especially for people whose incomes are low. And I'm going to stop there because I know other people want to add there, and I have a lot more to say on the subject, but I'm gonna let you pass it on or follow up.
So what I think I hear in that is homelessness is an expensive housing problem, but it's also an income problem from your point of view.
That's right. I think you can address it by subsidizing housing to make housing more affordable and or finding ways to raise folks' income so that they can afford rent on the market. Those are a couple of the key factors that need to be addressed.
So we've heard this description of housing being about housing is too expensive and incomes aren't high enough. I'm interested in taking the conversation to Paul. And when you think about when you hone in on the problem, what do you think is the problem that we need to pay the most attention to?
Thank you, Chris. Thank you, everybody, for allowing me to be here. In my view, when I look at not only the federal policy, but also the amount of money that's been spent on homelessness in the tens of billions of dollars over the last, I want to say 20 some odd years. And we look at the capacity that money has provided, and then we look at just the raw numbers of, is this money and is this capacity actually reducing the number of people who are experiencing homelessness or the number of people who are living unsheltered. My analysis is that this is a problem of leadership, in that we have essentially people dying on the streets and not enough people are jumping up and down with their hair on fire saying, we got to fix this. And the second issue is that this is a problem of policy. Regardless of what happens here in Kansas City or Los Angeles or Atlanta or Austin, Texas, the majority of homelessness policy is driven by, in my view, a failed and dysfunctional federal policy that is very narrow and restrictive and awards incompetence. So those are pretty big words, so I'll just leave it at that.
Well, so what I hear in that is we're doing it wrong, and
Correct.
we need to do it differently.
Correct.
Well, what exactly are we doing wrong?
Well, we're awarding processes instead of outcomes. We're failing to connect the dots between program provision, what happens at the program level, and the estimates of people who are experiencing homelessness, unsheltered homelessness, chronic homelessness, homeless people who have serious mental illnesses, and people who are experiencing homelessness with substance use disorders. We're not connecting those dots. And so what happens is we just keep getting the same thing. The money continues to go up. The capacity continues to go up. What I mean by that is we've got more permanent supportive housing, we've got more shelters, we've got more outreach workers, we've got more mobile showers, we've got more of everything than ever before. And yet homelessness continues to rise. So my old boss used to say, we're leaning the wrong ladder against the wrong wall. And because the federal policy, which provides most of the dollars at the local level, it's really difficult to get out of those lanes. So that's why it's a policy problem.
So we've heard kind of two different interpretations of the national problem. I'm interested in taking this back to Kansas City now. And so Kansas City, if you look in your facts sheet, zeroing in on Kansas City, the highest percentage of homeless people living unsheltered in the United States at 95.7%. There are challenges with handling chronic homelessness, insufficient low barrier shelters. Josh, I want to start with you and then to Stephanie. When it comes to homelessness in Kansas City, like, what's the problem? How would you describe it? How would you help people understand, like, what's really at issue?
I think it starts with the fact that it's not believed to be solvable. I think it's one of the most frustrating aspects of doing this job. In almost every conversation, homelessness is really thought of something that's going to endure forever. And if you don't believe you can solve the problem, you have no hope of solving it. It's true personally of each and every one of us. I'm not a motivational speaker. That's not what we're doing. You could do it. The reality is if you don't think it's going to be solved, you're not going to find or seek solutions that represent solving that problem. The other thing is we're not defining it well either. When we say homelessness, there's a picture that goes into all of your heads. But homelessness is a spectrum. It is a wide spectrum. And the way you solve it for one part of the spectrum is absolutely not the way you solve it for another. And what we try and do is solve it all the same. And it's not possible to do that. So just bear with me here. So we're going to pretend these are the spectrum, all right?
We had those specially placed for you to do this demonstration.
So these are rough numbers, so just bear with me. You can fact check all, but just bear with me, all right? So the overwhelming majority of homeless, we're going to say that this is 10 total water bottles. We're going to pretend that these are 8, all right? Those two there. The overwhelming majority of homelessness is circumstantial. Something happened. Some money issue happened, whatever, health, lost job, transmission went out. This homelessness is solved economically. This homelessness is not. So when I say the word homeless, this is who you think about. Person outside wearing 55 coats in July, talking to Abraham Lincoln. All right? This is who you're thinking about. This homelessness is not solved economically. It's not possible to solve this homelessness economically, but we keep trying to do that, and it's failing every single time. This is what has to shift. We've got to define at what level we're solving this, and then we've got to reallocate resources to solve for each side of this thing. But it starts with number one, you got to believe you can do it, and number two, we've got to have shared goals, shared language, and we've got to start approaching this problem similarly. That's where I'd start.
So giving you a chance, like, so Paul, had a description of this, being misaligned. Like, is that your experience in Kansas City? Do you experience that misalignment?
100%. Yeah, so like we keep saying, one size does not fit all. But the federal government keeps saying, one size fits all. Just put them in housing, put them in housing, put them in housing. If you don't know how to live independently, you're not going to maintain your housing. It's not going to happen. And here is the cascading effect that continues to happen. Okay, someone has severe persistent mental illness, substance use disorder. You put them in an apartment alone. What do you think is going to happen? If they're not surrounded by supports and they don't get them, it is not equal. Vouchers don't equal support. Vouchers just equal a key, and that is the federal government's number one arsenal in solving homelessness is a voucher, which means you go live in this apartment. We don't have near enough connected services. We're not checking on them. We're paying for vouchers for people who probably aren't even alive. We don't know. We don't check on them. Maybe once a year we will check on them. That's not good enough. So when you have this, your vouchers are completely reliant on landlords. Just because you have a voucher doesn't mean a housing unit was created. That's not how it works. It's the same housing market you all use. Everyone, it's the same one. So if you behave a certain way in housing, what happens? You have to at least satisfy the basic conditions of a lease. And if you can't do that, you can't live there. So what happened in Kansas City is landlords started to figure this out. If I take a voucher, it's resulting in, number one, it's costing me a lot of money. All my emails are a result of these vouchers. So what they're saying is, I don't want to take vouchers anymore. So now we're in a system where we have more vouchers than property owners that are willing to take them because we have not addressed the behavior behind it. And I think that is a complete disservice to this population. They deserve more. We need more funding for this. It's not good enough. We've got to do more. That's a bit of a snapshot.
So Stephanie, we've heard Josh's description of our water bottles kind of needing individual attention and not one plan for all of our water bottles. Like, what's your description? Where would you want to take this audience in terms of understanding this problem?
Yeah. Well, I think fundamentally, just to go back real quick, homelessness is fundamentally a housing problem. Okay, it is a housing system problem. It is about having enough units that are affordable to every income level in our community. And as a community and as a country, we have not really been as intentional as we've needed for a whole lot of years about making sure that we are creating housing that is affordable at every income level, right? So is anyone, raise your hand if you're a business owner in this group, okay? We have a few. Okay, so to every business owner, right, think about every level of job that you might have in your company. You may have entry-level positions, and you may have executive-level positions. And those salaries can sometimes have really big gaps in them, right? And so if we are not, that is the case in every company, in every business, anyone that employs anyone. And so you have folks in those lower incomes that do not have enough opportunities for places that they can afford, right? And affordability is at all levels. So 30% of your income, you should spend no more than 30% of your income, right? The 50% that Anna mentioned, those folks are at risk of homelessness. If anything happens in their life, their job changes, they get sick, those are the folks that are going to be at risk of homelessness because they're already overburdened in what they're spending in their housing. And so it's really important that we recognize that. So whether you're making $30,000 a year or you're making $130,000 a year, you should not be spending more than that 30%. The units at those lower income brackets in that 30% are just not adequately available. So they have to be subsidized, and or we have to invest in properties that carry no debt, that can be rented at those rates too. There's many ways we can go about it. It is a solvable problem. I do believe it is. I know Josh believes it too, because we believe the same thing. But and I believe it's definitely solvable in our community. And yes, Josh's demonstration is a good one. As an organization that runs programs from prevention to street outreach to emergency shelter to transitional housing to permanent housing, I can tell you that all those things work when they have the proper support systems surrounding them, okay? When I talk about shelter, I'm talking about a program that people come into, they do not leave every day, not an overnight shelter, not an extreme weather shelter, a place that they are there for months, that they have safety and security to know, I have this resource, and I have a case manager walking alongside me, and I have the proper support systems that I need to be able to find a pathway out of homelessness. It does work every year, and the problem is for every bed in every one of those programs that we operate, there's 100 people waiting for each one of them, right? We turned away 414 families last year from our family shelter. There was nowhere else for those families to go. They are living in cars. They are living in storage units. They are renting U-Haul trucks. People are having to get very creative in this community. These are the folks that Josh was talking about over here that you don't even see, right? That's not who you think about when you think about homelessness in our community. But that is the bulk of what we're talking about. And so the problem is, programs do work when they have the proper support systems. The problem is we need to continue to build capacity in that so that we can serve all those that are still waiting. And we have to simultaneously be creating housing that's affordable, because I can guarantee you that all 414 of those families, if I had had a unit that they could actually afford today, they wouldn't need to come into my shelter. Now, they might need some additional supportive services, but we can get those. Kansas City is rich in resources. We have a lot of amazing programs and organizations that are doing great stuff that we can surround people with those. But those families, they just simply, the first thing they needed foundationally was a place they could afford to live.
So, Chris, I'm going to be the skunk at the party, because I always am. I disagree that we can solve the affordable housing crisis with respect to homelessness. And what I mean by that is we need to make a distinction between the problem of the economic problem of increased the need for additional housing, which I totally agree. We need more housing at all levels. The identification of the problem isn't the solution, because when you look at what government can do to bend the cost curve of housing, you got to remember, and if anybody doesn't qualify, doesn't identify with this, what is the number one most expensive thing that you spend money on every month? It's housing. Doesn't matter if you're at 30% or 50%. And what's being proposed is that the government then should step in to people who have little or no incomes and subsidize the most expensive commodity that they need every month. That is economically not solvable by government, at least not the form of government that we have right now. Now, I want to make a distinction because the difference is housing versus homelessness. Now, and here's the problem. We need to think of homelessness, the provision of housing has been demonstrated to not decrease the number of people experiencing homelessness. This isn't a new thing. This is public policy that's been going on since 2009 with respect to the current way that we address homelessness. We have 680,000 units. We've created 680,000 units of permanent supportive housing in the United States for a number of people experiencing homelessness over 700,000. That should take a big chunk out of it. And yet, last year, we saw more people. There were more people counted homelessness than ever. What is going on?
Can I answer that?
Certainly.
What is going on? Yes. It's that there are more people flowing into homelessness who are forced into homelessness every year than exiting. And that's, like you've explained, the homelessness response system is getting better and better every year at rehousing people. We're rehousing more people every year, building more permanent supportive housing, for example, but we're not turning off the on spigot that is forcing people in the first place. And this is where Paul and I disagree, that I think we have to fill that gap between people's income and rent, because it not only causes homelessness, it forces families every day to make the decision between, am I going to pay rent this month, or am I going to put food on the table? Am I going to be able to fill up the gas in my car so that I can get to work or take my kid to school or to the doctor's office? Those are the decisions that families on the cusp of homelessness are having to make every day. And that is untenable. In the wealthiest, most powerful nation in the world, that's unacceptable. Right now, only 1 in 4 people who qualify for federal rental assistance receive it because Congress has decided not to fully fund it. So that means out of every 4 families who should be getting assistance, they qualify for it, they need it, 3 of them aren't receiving the help that they need. And like Josh and I were talking about backstage, that leads to really long waiting lists. So people are applying for rental assistance and they're just not getting it. Oftentimes communities close the waiting list entirely because there's so many people already on the waiting lists. It's unacceptable to let this continue. There are also policies that can help on the income side of things too, right? Like having a living wage so that people, like everybody who works a full-time job, that should be able to cover their basic needs. And it doesn't. So in Kansas, I found that in order to afford a modest 1-bedroom apartment on the market without rental assistance, you'd have to work 2 full-time jobs, 91 hours a week. That's untenable for just an everyday person. It's untenable for a single parent, right? Like that's what we're asking of people. So I like to think about the homelessness response system as the emergency room of the housing system. And so we have been strengthening the emergency room. But, if over the next month, a bunch of people started to show up to KU Med with heart disease, like a whole bunch of people are showing up with this problem, we wouldn't blame the emergency room for them showing up. We would be like, what's going on? People aren't getting the primary care that they need to prevent them from having a heart attack in the first place, for example, or to have this blood pressure problem. We would turn upstream of how do we keep this from happening. And it is going to be expensive. I'm not going to pretend that it's cheap. But like I said before, we're the wealthiest nation in the world, and instead of making that kind of investment, Congress is considering cutting taxes for the ultra-wealthy. And I'll stop right there.
And my just quick comment to that is, that is not a homelessness policy issue. That is an economic subsidy. That is a whole different economic subsidization of people who are poor or who are or low income. So that is a different policy question. It's related. I'm not suggesting it's not related, but it's different than what are we going to do with these people who are living and dying on the street? We're not going to enhance their economics because they don't make any money. Once I talked to an economist and I said, why are we talking so much about economic subsidies and the efficacy of economic subsidies when a large portion of the people who are home, they have no income? You can't plus up zero income with economic subsidy. Why is that? And they said, well, it's because homelessness isn't an economic issue. It's a health and safety issue. And so my response is, yes, we could work on these grandiose, dare I say, more socialist views of economic redistribution, income guarantees, price controls on housing. We can do that. Or we can scrap the current homelessness system that has been failing us for more than 20 years and actually start focusing on the real issues and the real data and the real failure of relying on housing to address a public safety and health issue.
So we've surfaced some contrast, which is great, because that's what we're here for. And if you want to contrast some more, we're going to have more opportunities to do that. But I wanted to check in and see if we had any questions or fact checks from our roving reporter.
We have a few roving reporters.
We got lots of them.
And the good news is no fact checks so far. So we're just going to ask you some questions. And so tonight, doing this role, we'll have Megan and Sophia ask questions with me, and also we have Alex and Naomi. This will be probably for the two local experts. What is the demographic breakdown in KC Metro of homelessness?
Our data is terrible. It's horrible. Our data is terrible. So there's a term, it's called quality data. I know you've heard those terms before. It's meaningful in a system or a city's pursuit of solving homelessness. So if you're curious of the Kansas City's approach, it's called Built for Zero. Community Solutions, it's a national program, Built for Zero. Functional zero is the term. Functional zero means you are able to address the homelessness of anyone who becomes homeless, and within 30 days, you solve their problem. So you can zero out at the end of every month. Because look, to prevent every human being from becoming homeless, that's unlikely. I'll just say it's unlikely. But if you have a system that can solve for it in real time, that's incredible. But that requires a significant investment in data, and also requires everyone using it. So 2/3 of the organizations in Kansas City are privately funded, which means they are not required in any way to share data. What do they use their data for? Organizational excellence. It's all proprietary, so they just use it to get grants. Look how great we did. And yes, you did great. You did a wonderful job, wonderful. But your greatness is not connected to the broader system. So the question is always, what is the number total, and is that number going down? And when you have most of your homeless serving nonprofits not connected to that system, you don't know. So the real answer, we don't know. Now you can look right now on what you're going to Google is point in time count Kansas City, or point in time count, Missouri 604. The point in time count is about the absolute worst way to conduct a census. We use it every year. If you Google right now, how many homeless folks in America, a number is going to pop up. That number is from the point in time count, and that number is terrible. It is wrong. It's wrong on every level. What you do with point in time count, just so you all know the lunacy of how we do this, you go out on a day and you find people and you give them this survey, and the survey gets longer and longer every year. It's like 5 pages now. You have to complete the survey. And based on the number of people that you find and you count, that is the number that they send to HUD. So there's a lot of things that can determine how many folks you're going to find. How many volunteers did you get that day? Did it snow that day? Because you're going to get less volunteers then. Or did you find everyone? Because you got to go out in the woods and look for, right? This would be like if the governor called the mayor of Kansas City and said, hey, I want to know how many cars are in Kansas City. But you can't use any DMV data. What you have to do is you have to go on the street and you have to count cars as they drive by. Well, what about cars that are in garages? What if we don't have enough people on the street? That's literally how it is. So that number that you're going to see there, it's based on the point in time count. Now, we've done a lot of data cleanup in Kansas City. It's been really, really hard. We believe that there are 4,150 individuals experiencing homelessness outside in Kansas City. The point in time count says maybe 1,000. We don't know what the number is the answer.
That's a very substantial answer for we don't know. We have another question.
Can I add a national perspective really quickly? And it's just that people of color are extraordinarily overrepresented among people experiencing homelessness across the country, particularly Indigenous folks, particularly Black people. I don't remember all the stats off the top of my head. As well as people with disabilities are very overrepresented. That's just a little bit of context that speaks to the national picture.
Yeah, to agree with Anna, the typical demo is African American and or white, usually between 25 and 45 years old, because a lot of folks who are living unsheltered don't live past that too much. Disability usually has some self-reported mental illness and some self-reported substance use disorder. Yeah, if it's demographics, the African American community is profoundly overrepresented in Kansas City. I think it's among the worst in the country.
And I just want to remind everybody of the context of why that is. It's due to generations of, and the accumulation of generations of discriminatory policies and practices that have denied Black people, other people of color, other marginalized communities access to home ownership, access to economic opportunities, good jobs, quality education. So yeah, just want to make sure we say that.
Do we have another question?
Yeah. This question is from 18-year-old Evelyn. If homeless people are able to get more housing, or even if they're not, how can we get them jobs to maintain a stable life?
Maybe Stephanie should step in on this one.
So I'll tie back into the previous conversation around income, and I would say that, and we just talked about how folks with disability are overrepresented in that population, and it holds true to what we see. Actually, the majority of people that we see come into programs with us do have income. They are living on Social Security or disability, and they are working minimum wage jobs. That is the population that we're really talking about, that we need housing units that those folks can afford, and that takes care of a whole lot of this majority down here. So yes, getting folks, what we find too is I wish I could literally video and watch people, that you guys could come and stay for months with us and see the transformations that we see. When folks come in to our shelter program, literally within a week or two, you see physical, emotional, and mental changes that significantly. And the only thing that has happened in that time is that they are in a safe, stable situation. They do not have to worry about where they're going to sleep tonight. They do not have to worry about where they're going to eat today or if they're going to stay safe. They are simply able to not live in that survival mode and in that part of your brain that's all you can focus on, okay? Literally having housing takes people out of that and puts them in a situation where now they can start working on what's next. What do I need to accomplish? Maybe I have a job, but I could get a better job. But that's really hard to do if you're out here sleeping in your car and, trying to keep a phone charged, all these kinds of things, right? But when you're in a situation like this now, then you're in a space that you're like, you know what, I can work with this employment specialist and she can help me take that leap to this better paying job that I couldn't get to out here, right? And then there are opportunities, of course, for folks to receive different education and training to elevate what that looks like, right? So we layer in tons of resources and tons of community partnerships. We have Great Jobs KC here in Kansas City that is funding tons of great opportunities for people to have access to jobs that can pay them far more than a living wage, which is great, right? We have a Department of Labor grant for veterans that we can literally pay for them to go to training. We have veterans that are going to all different kinds of training, but a lot of them are getting their CDL and going to drive trucks, and they're jumping to $70,000 to $90,000 a year. That is life-changing. And for $5,000 worth of training, their life has now changed moving forward, right? They're not going to be experiencing that housing instability because they now have a tool in their toolbox that's going to be a way for them to make far more than a living wage. And that's what we have to continue to provide, those opportunities for folks. And it does go back to they did not have access to educational opportunities and things as they were, coming up. We make sure in our youth programs to make sure that young people have those opportunities now so that they're not 40 and 50 years old trying to go back and figure that out.
Let's pause that and let's see, we might have one more question. I think they might be rolling in. So.
Yes, this is my question for Mr. Webster. With the current political landscape being as polarized as it is, in conjunction with the many issues of today, how do we prioritize solving homelessness on the federal level?
It's a great question. Very difficultly. And the reason isn't because of necessarily the issue of homelessness and the humanitarian crisis that it is. I think it's more in terms of other competing issues that the federal government is, prioritizing above it. And, you could agree or disagree. I know that in my work at advocacy at the federal level, we are really having to pressure HUD to make significant reforms with respect to flexibility of funding, data quality, data consistency, outcome measures, regulatory challenges that program providers are burdened with, where they could spend more time serving people instead of this. So we are working on that. We're very optimistic, but yeah, there's a lot of things going on, and it's one of the things that we're really focused on reforming with respect to federal policy does actually have to do with getting jobs and getting into sobriety treatment programs, and that policy is a prohibition on programs requiring participants from engaging in any kind of activity. So while it's nice that these programs can offer, hey, is it about time you got sober? Hey, you've got disability income, but maybe you should get some earned income. Hey, you know how your mental illness is not stabilized? Do you think about treatment? It's all suggestions. And the problem with that isn't the parochial nature of it necessarily. The problem is that when you give somebody who is receiving any kind of subsidized benefit a choice that would move them out of that subsidized benefit, they often maintain the subsidy and the benefit instead of doing the work that would move them out of that subsidized benefit. And if you don't believe me, you could look at the 40 years of welfare programs that occurred in the United States prior to 1996, where we were subsidizing dysfunctional and dependent behavior. And so I'm not suggesting that we have to, jam the pendulum to the other side, but we need to be very cognizant of the incentives and disincentives of providing publicly provided benefits.
So when there's so much to unpack, where were you going to go, Stephanie?
Well, I was just going to start by saying two quick things. One, that I do not think this is solved at the federal level, you guys. The federal government has never solved a social issue in its entire existence. So why are we looking to them to solve it, right?
Because they're the one who's paying right now.
They should be a contributor to the payment, to the money. Yes, I do. I'm not saying they get off scot-free here, but I'm just saying, wouldn't it be beautiful if they just gave local communities and states and cities the allocation to allow us locally to solve this problem, right? Because this is solved at the local level, and never underestimate what a small group of people who can come together around like-minded things can make a lot of, can we cuss here? A lot of stuff, amazing stuff happen, okay? You know what I really wanted to say there. So I think that, I just hate when I hear us focus too much on that we have to bring it back to the local situation. And now I forgot what my second thing was, so go ahead.
Sorry for interrupting.
That's
your
okay.
Line of thinking. I wanted to circle back to the point around what happens when somebody's receiving assistance for a long time, or for any amount of time. And so a point I want to make clear about rental assistance and how it functions is that it doesn't have the kind of cliff. So often the thinking is people get some kind of assistance and they're afraid, for really good reasons, to try and raise their incomes to the point where they no longer receive it, because what happens when they fall on hard times again, right? So there's a genuine concern depending on how a program is designed. Rental assistance is not designed in that way. You pay the share of rent that you can afford. So that's roughly 30% of your income that you can afford. And as your income goes up, the rental assistance goes down gradually. It's not a dollar for dollar. And so same, if your income goes down, the rental assistance goes up to help cover that difference. Now, when it comes to disability benefits, right, it's super hard. I spent 3 years of my career helping people apply for Social Security disability benefits for SSI. It's extremely difficult to prove that you qualify. And so getting those benefits taken away is really scary, because it might be really hard to get it again. There are specialized programs that people can use to start working and still receive their disability benefits. It's super complicated to navigate, and so we should make that easier. It was a big question that I got a lot of times when helping people initiate that process, was I don't want to give up on working entirely, but I know that I can't right now. And helping people understand it's not an all or nothing, but we need to help people have both and have.
And I totally support getting rid of the EITC cliff.
The point here is about choice, right? Giving people meaningful choices that allow them to pursue their own goals, right? And so creating policies that support people in doing that, rather than creating sort of fear-based motivators. Either way. Not into coercive methods.
Yeah, so really quick, she brought it up again. So I wanted to bring a real life example in this, because I do think it's important. I want to try to bring the voice and the real stories of people who do have lived experience and who we have served and who are experiencing homelessness into this conversation as much as possible, because I want folks to really understand these are real people we are talking about, right? So to go back to the assistant situation, right? Each one of those programs, they do not work together. They work in silos, okay? So someone gets up here and gets off one. Now all of a sudden I lose all my food stamps. And so now I'm supposed to go from this to that, right? There's not a gradual thing to some of these things. So I'll give you an example. During the pandemic, we had a young mother with 2 kids who was working. She had the opportunity to work a lot of extra overtime at her job because there were such few people working, right? Well, she had applied to a brand new low-income housing property that was income-based, right? So she was all set, ready to move into here. As they finalized all the paperwork with her recent pay stubs, she was $2 over the limit for income because of the overtime that she had worked at her job. So as a system, we told her she's going to now go from paying $800 for this 3-bedroom apartment to she needs to be able to double that because she made $2 over the limit, right? For overtime, that is not guaranteed pay, right? Now, during that time, there were folks that could pick up a lot of extra time. So we have a lot of policy issues like that that need to be addressed, right? That one, we'd love to see overtime bonuses not included in those calculations. Those are not guaranteed income for anyone. And so it's just really disheartening to see those opportunities happen for folks. This woman was working her tail off, right? Doing all the right things. And that's the way the system's sort of designed.
So I want to jump in with a maybe flawed and like problematic question, but one that like, because there's just so much like coming up here. And I want to try to like get closer to the root of things. And so we've talked about, both Josh and Stephanie have talked about homeless being a solvable problem. And so if I gave you no more than 10 words, what's the solution? Help us understand what the solution is.
So I would say create housing at all levels, right? So I'll give you guys a good, if you're into data and you want to know what data, there's a book called Homelessness is a Housing Problem, written by Dr. Greg Colburn out of Washington State. Okay, they've examined data from all across the country around homelessness and housing. Okay, and in all of that, again, it comes back to that the housing system and infrastructure is the solution. So that is where we need to focus. And a couple of the key points that they talk about a lot in there is when you see in a community high rental rates and low vacancy rates, that equals high rates of homelessness. Okay? Okay, guys, then we know the problem, there's a solution to it, right? We have to address it. From both those sides, right? Which means we just need more units at all income levels. We don't have to just focus on creating low-income housing. And he and his team will say, just get to creating units, right? Because people will move around into different units. As a brand new unit comes, if you can afford to move there, you're going to move there. It opens up a unit for someone else that's maybe in the middle, right? So we just keep doing these shifts in housing. So that's what I would say.
Josh, what about you? What's within your 10 words? What's a solution?
No.
That was more than 10 words.
We're not going to do 10 words.
But I want to defend this question too, because like we live in a TikTok world and we want to keep people's attention. Like we have to talk about the depth, but we also got to have a message that people can understand. And if we can't say it quickly, how are people going to mobilize to do the stuff that's necessary to address an issue like this?
I think the kind of the thrust of that question has been the problem entrenched in trying to solve it, which is 10 words suggests there's a silver bullet. There's not. Every generation has tried to have a silver bullet. When you understand the history of homelessness, you see this. We have tried this before. So there's 3 main eras in homelessness. There's the Romantic era, there's the Skid Row era, and there's the modern era. Each era is defined by a perceived silver bullet, the 10-word answer. In the Romantic era, it was alcohol. If we stop alcohol from being a problem will stop homelessness. That's the plan. Prohibition, let's do it. Didn't work. Skid Row era, it's jobs. If everyone has a job, then we're going to stop homelessness. That's it. So the 10 words, get everyone a job. Less than 10, it's a rebate. Modern era. In the 1970s, this is where we get the word homeless. It used to be hobo, tramp, and bum. Hobo, tramp, and bum, they weren't necessarily derogatory terms, but they fell out of fashion as the idea of a hobo. Hobo jumped on a train, went to different cities, did labor. It's because cities were small. There wasn't a big labor pool, so labor had to move. Hobos built this country. That's the reality of it. But as cities got big, there was no need for hobos because you had labor there in town. So hobos became tramps, became bums. Bums drank, bums didn't work, so alcohol, work. Well, in the late 70s, it was the issue is home. So the word is homeless. Homeless is it. Let's get everyone homes. That's going to solve the problem. There's no silver bullet.
I'm going to answer this question in 9 words.
Let's count it.
Now I'm under pressure. Collect good data. Pay for performance, demand accountability. That should be 8 words.
You got 2 more. Do you want to use them?
Do it now. That's 11 words.
We'll round down. That's been our pattern.
I think I've never heard anybody describe the eras in that way, Josh. I think that's really interesting. I will say I don't think that we've given the housing era quite the shot yet from an investment side. But to answer your question, I don't know how many words this is, but I'll say guaranteed rental assistance for everyone who needs it, and comprehensive universal access to healthcare, all of the healthcare.
Yeah, we're not supposed to clap. I guess I get to use that now? Is that the right way to do it?
He's just been waiting for an opportunity to click that bell.
So, Chris, I do. It's so difficult to pull the issue of homelessness away from this notion that the provision of housing reduces the number of people experiencing on the streets. And I have some data that we did some analysis both on the point-in-time count, the awards that are made to communities to provide assistance to people experiencing homelessness, and what's called the housing inventory count. So every year, HUD requires communities who get homelessness assistance dollars to do this annual count. They give them money. Money always goes up, never goes down. Well, it does go down occasionally, like 2%, but then it goes up 7% next year. And it also requires communities to collect the number of units, housing inventory, that are there. So this is the results of the analysis. So the provisional housing drought received the number of people experiencing are on the street. A larger percentage of awards are going to subsidize rents rather than supportive services and new projects. So what's happening is as the number of people on the streets increase, the number of permanent supportive housing units actually are increasing faster, which means that what is happening is the government is paying more for subsidized rents than they are for supportive services, and for new projects, that is the ability to get new units on. So the problem is that, and when you look at utilization rates, like, you know, if a community has, let's just make round numbers, 1,000 units of permanent supportive housing, on average, only about 85% of those are actually utilized. And in fact, the curve for, I'm using economic terms, but the curve for the demand of these units is actually much more reduced because of the fact that people exit units and because there's so much transition in units. We're having a real problem with utilizing the housing that we have. So if housing actually was effective at solving this problem, we would have higher utilization rates, we would have a reduction in the number of people experiencing housing as units came on. And an honest point is, yeah, but what we're trying to do is we're trying to empty the ocean with a paper cup. There's too many people I hate the term falling into homelessness because it's not like you're tripping on a curb, but there are people becoming homeless without the rate, but there's no data to suggest that that's the dynamic. So the only data that we have to go on right now is point-in-time count, what the awards are paying for, which are subsidized rents, and the utilization of those units. So, and this is why I'm not trying to argue against housing or anything like that. I'm just trying to keep focused on what the system that we have right now, is it actually effective or is it not? And if it's not, it's actually contributing to the increase in people experiencing homelessness. We need to fix that.
So there's not going to be consensus on this, but I want to allow for like a pithy response if there is one elsewhere on this panel, but pithy, because I want to go to our fact checker here in a second.
So I would just like to add really quick to that for all the government housing assistance that there is out there is little to no. A lot of those come with zero supportive services dollars, okay? And some of them come with a tiny bit of it. The only reason we have the level of supportive services dollars that we do is because we go out and raise the money, and we have other community partners, and we have local foundations, and we have local people that are contributing to that, okay? So you have to go about it one way or the other, right? So for all these years, so I feel like we can't sit here and say we've been doing that, but it hasn't worked. You've been doing the one part of it. And some communities are richer in resources than others for those supportive services, right? We are pretty fortunate here to have so many different groups that are willing that understand the importance of those and that those dollars are what actually make it work. And to go back real quick to the data I shared, or the rental rates and the vacancy, to put it into perspective locally, right, over the last 5 years, we have seen rental rates go up 30 to 50%. Our vacancy rate went from 8.4% to 4.8%, right? So it is no wonder that the last 3 years, year over year, we've seen a 30% increase in people experiencing homelessness, right? The data ties together.
But what you're doing is you're implying causality when there is no causality. The error in your logic is that, well, this went up and this went up, so they must be connected to one another, and there's no data to suggest that. And that's just the fact. So you can't imply causality based on something that seems as if it. So and that's the challenge. That's why I say we need good data. We need so much better data that actually demonstrates what is happening. Because here's my thinking.
Can I give you a data point?
Yeah, please, go ahead.
So you described some of the data that continuums of care, homelessness continuums of care report. Well, one piece of data that they have been reporting too is how many folks are experiencing homelessness for the very first time. And in the recent years, we've been seeing record numbers of people experiencing homelessness for the very first time, which does suggest more people are being pushed into homelessness.
However, the HMIS system isn't connected community to community to community. So the challenge is that we're not really sure if those people are counted more than once. It's a nice question to ask in the point-in-time survey, but we really don't understand whether or not that is a true function of a housing market, of a rental market. I could say that since the advent of the huge increase in illicit drugs, methamphetamine and fentanyl, that is now causing over 100,000 deaths a year, and the fact that the producers of methamphetamine and fentanyl have specifically targeted those drugs to be the cheapest drugs on the market, I could say because of that we're seeing more increases in homelessness. But I can't say that because the data doesn't, there's no causality to that. So it's a fond notion, but we just don't know that that's true. And that's why we need to have better data, and we need to have more accountability, and we need to pay for performance. And what I mean by pay for performance is, look, if you could do an incantation in front of a park that is full of people living unsheltered in deplorable conditions, if you can do an incantation and you can show me that every time you do that incantation, the number of people experiencing homelessness goes down, I will support it all day long. But you just have to connect those dots, because when we don't connect the dots, it's like ifs and buts were candy and nuts, then every day would be Christmas.
So I'm working on an incantation to check in with our fact checker. Leah, do we have any questions or fact checking?
Yes, we do. Can I come to the mic?
Please do.
Well, I originally wanted to come to the mic here to talk about our 2 fact check questions that came in, but some interesting things that just came up on the panel. I wanted to note that according to the National Low Income Housing Coalition, a report from April 2024, it does seem that there is a connection of sorts between vacancy rates and homelessness rates. So this particular study, published last year, found that a 10% increase in vacancy rates was associated with a 3% decrease in rates of homelessness among adults and families. So,
Did you say that? I'm sorry, could you say that again? Did you say a 10% increase in vacancy rates resulted in a 3% decrease?
it was associated with a 3% decrease in rates of homelessness among adults and families. I can dig into that more, but I was just spouting off something over there. I've got my team here from University Academy to talk about some other things.
Okay, my name's Anaya Coleman. I'm a student at University Academy.
Let me pull up your data here.
Okay, according to censusgovernment.org, most people experience homelessness don't have income.
No, we're fact checking this question here, this question that came in. Can you read that out loud to the audience?
So one of the questions was, most people experiencing homelessness don't have income.
And that's not what we ended up finding from the census.
I'll qualify my statement. Most people experiencing homelessness don't have earned income. They do have income vis-a-vis social benefit programs like disability, and in fact, according to SAMHSA, so there are 2 types of disability that Social Security provides. One type of disability is basically disability that, if you were on the job, you paid into disability and you were injured, you receive, a benefit because now you're no longer able to work. The other kind of disability is like a medical disability that says, this wasn't job related, it's some other kind of disability. One of the challenges that's happening right now is that the disability, and to Anna's point, it is relatively difficult for most people to qualify for disability benefits. In homelessness, that's a little bit easier. And part of the reason that it's easier is because, according to the Substance Abuse Mental Health Services Act, there's a federal program called the SOAR program that actually encourages people as their intake who are experiencing homelessness to qualify for disability benefits. And one of the ways that you can qualify for disability benefits is by being chronically homeless and by having a substance use disorder. And the challenge with that, yes, that's true, Anna.
I was a SOAR case manager for 3 years.
So So I think you've gotten some points out there. Let's see if our fact checkers have anything to finish, and then we'll move to the final part. Do you have anything else that you need to get out there?
Do you want to try to knock that, or you want me to?
Oh, it's really vague, but there's a gray area when deciphering whether or not homeless people have an income or whether or not they do have jobs and the likelihood of that.
Well, they're not quite the same thing. You can sit there and say that somebody has a job versus someone has income. Income could be something like short-term disability, which we talked about earlier. So we just found some different data points coming in. For instance, the Census Bureau report from February 2024 said, could you read that out loud, Haley?
Oh.
That pink part.
among the sheltered population, age 16 and over experiencing homelessness, nearly 15% were unemployed, and an additional 61% were not in the labor force. That means only about 25% of this population was employed, compared to nearly 60% of the population in households and other living quarters.
But see, that's where we have to dig a little further. There's a difference between not having a job and not having income. And so something else that we found from the United States Interagency Council on Homelessness, we also found this interesting fact versus fiction comparison. The fiction here that people experiencing homelessness just need to get a job. This fact check here found, can you read that out loud, Anaya?
Yes. Fact. While employment helps people stay housed, it does not guarantee housing. As many as 40 to 60% of people experiencing homelessness have a job. But housing is unaffordable because wages have not kept up with rising rents.
And to just put a pin on this from a local perspective, my publication covers Johnson County, Kansas, so that's my area of familiarity, and our understanding is a data report coming in from United Community Services of Johnson County, which calculates their own point-in-time count. They also do the front door efforts on local coordinated entry systems, the CES that I think we've touched on that too. Their data shows that up to 59% of people experiencing homelessness in Johnson County, the wealthiest county in Kansas, also have their own sources of income. Again, to clarify, income is not the same thing as having a job. So those are two separate data points to distill when we're looking at the data. So thank you to Haley, and then I have.
And there are a lot of people who are unsheltered who, they work itinerantly, they work for cash, they trade, there's a lot of different ways to make a dollar. And so that's kind of part of the challenge.
So I don't know, we have something else? What else do we have? What else could we possibly have?
We have more 9-word answers.
So I think we're kind of at our, okay. Okay. So yes, go ahead, but pick a panelist if you can, please.
Okay, we have 5 quick ones. So rapid fire. What % of homelessness veterans among the homeless population, and are they or should they be treated differently given the contribution to the safety of our country?
They are treated differently.
Vets have the highest rate of subsidy among the unhoused population.
Yes, I tell everyone if it's like the Cadillac version of a program. If every one of my populations had access to all the different types of layering of things that we can do with our veterans, we would end homelessness. We did it with veterans actually already in this country, so we actually have proved that we can do it.
Okay. This question is from Jennifer from Belton. Is it helpful to hand out money to individuals begging on street corners?
No, don't do it.
Yes, it's fine.
It doesn't help. Look, what's
Follow your
goal?
heart.
The goal is ending homelessness. That is not going to end their homelessness. Give that money to an organization that can help them end their homelessness. That is my advice.
It's fine to give people cash if you feel so inclined, if you want to help them get a meal that day. It's not going to end their homelessness, but it could help them survive.
Okay.
I would think very hard about giving people who are in the realm of 50 to 75% substance use disorders cash.
Okay, I have a question for Stephanie. What is the biggest misconception about the unhoused or homeless community?
Oh gosh, the biggest misconception. There's so many. I think one of them is that people just need to get a job, right? I think just overall, like one of the biggest misconceptions around homelessness is that this is a people problem. And that we need to fix the broken people, and that's what I would say is the other thing we've done for a whole lot of years is we have approached it from that way, and we haven't approached it from the system and infrastructure, right? Again, going back to housing. So, yeah.
This comes from the live stream, a participant, and it'll be for Josh. The Cicero Institute encourages requiring upfront sobriety and requires participation in treatment before housing. How do providers
That's not
here...
true.
Okay. Okay, well, that is from live stream. Fact check. Okay, then. Well, the question is, how do providers see that as working or not working in KC? Whether there is a requirement that they would need to be
That's a
sober.
really big question. There's a lot of providers in Kansas City, and many of them do require sobriety because their programs are literally built around sobriety. When I ran veteran services at Veterans Community Project, I did not require sobriety because that wasn't my goal. My goal was permanent housing readiness. Now, there were some individuals within the context of the village that if they had one beer, that wasn't going to work. But there were some that could drink 16 beers a day but had absolutely no impact on their permanent housing. So it depends on the agency.
Depends on,
Yeah.
okay.
All right, this one is for all of you guys. Have any of the panel members studied how other countries have tackled homelessness?
Yes, and it doesn't apply.
So my magic, like if I had a reasonable magic wand, it's universal health care. I believe that is like, if we had universal health care, this problem would look a lot different. American homelessness is beset with mental illness and substance use disorder. European homelessness, a lot of it has to do with immigration, how they do immigration. They also have different, obviously they have health care, they have access to health care, and they have different social housing programs that look very, very different than ours. And the number one thing, and this is the tough part, we have to solve problems in the reality we're in. The reality we're in, America is capitalist. First and foremost, it is a capitalist country, and if we try and solve homelessness not from that lens, there's a lot of problems, whether we like it or not. Look, I don't know that we're going to be able to dismantle capitalism on our way to solving homelessness. It seems like a pretty big
Next
thing to do.
event.
Yes. So when housing is a commodity and not a human right, you have to solve homelessness different. That's why it looks so much different here in America than especially in Europe.
So I would say that Sweden is a great example of a country who has been intentional about how they have built housing for all income levels, and so they don't have a huge homelessness problem to solve because their housing infrastructure has always been intentional. Pretty much every building of housing has every income level living in it, right? So I think they're a great example of, like, again, going back to that, how we structure the housing, like, really matters because they don't see that. We were talking about the income thing a minute ago. So one thing I wanted to say is, like, if the federal government really wanted to do one thing around this, it would be to raise the minimum wage. The federal level minimum wage is still $7.25 for anyone who did not know that. Okay? My 16-year-old has a part-time job making $13 an hour. Okay? But our federal government says it's really okay to actually still pay people $7.25. That's a big problem.
So I don't know how we got here so fast, but we did. We have come to the portion where you get the last word, and this is the one question you know going in. So what? Now what?
Okay. So what? We are all better off, all of us, if all of our neighbors and everyone in our community has a safe, stable place to live and access to the services that they need to keep that housing. So what are we going to do about it? We are at a moment where more and more people are recognizing that this is a problem that affects all of us. Homelessness affects all of us, as well as the affordable housing crisis. And we need everybody to tell their lawmakers, whether it's your city council person or your state legislator or your members of Congress, that this matters to you and that you want something to be done about it. I can talk till I'm blue in the face about the policy solutions, but we're not going to get anywhere until people demand it.
Any problem that can be solved is solved with people and money. That is how you solve homelessness. Here's the deal, though. 75% of people believe that their elected officials are responsible in some way for solving homelessness, but we don't hold them accountable for it. This is a local problem, and it's going to require local solutions. And if we don't step up and demand participation from our elected officials, it's not going to happen. They're not going to do it unless you tell them to. We have a very low voter turnout in Kansas City. Unless that changes, they're going to keep doing it the way they're doing it now, which is their toe in the water, doing nothing. Please participate, because we need your voices.
Yes, yes, and yes. I would say, again, educate yourself, right? You guys are doing it here tonight, so thank you for coming out to take into a deep dive into this conversation. Get involved. That means with organizations doing this work, get involved with the government, especially at the local level. And our local level does have a great budgeting process that they bring out to the community, but very few people show up to that, right? You will be astonished at some things if you dive deep into there. Again, this is about setting priorities, and your voice matters in that. Do you know that our city has been subsidizing $20 million a year for the last 20 years for the Power and Light District, and that is set to continue for another 20 years? What if we committed to subsidizing $20 million a year in housing for 40 years? We haven't done that yet, guys. Okay? So your voice matters. Become an advocate and become a loud voice. Because when all that our officials hear from is people like me running an organization, they don't care. I'm just doing my job, right? It's not something they really need to solve because I'm just doing my job. So you hold the power in this room and in your vote and in getting involved, and understand the decisions that they are making and dive deep into it. And I'll just go back to never underestimate what a small group of people here tonight could come together around a common goal and mission. We got to get to rowing the same boat in this community, and we're not. And Josh led to that earlier today. So get in the boat, guys. Let's go.
So what? So what that we've been spending billions of dollars on federal and local programs that don't fix the problem. If you care about the problem, then you should demand that the current policies and the current systems are drastically overhauled, and that you should be a pain in the rear end to your city council members, your mayor, and just like Anna said, every level of government saying, I demand change. Change isn't continuing to do the same thing. Change is doing something different. Listen, if you want to say, I support guaranteed income for everybody, I support price controls on housing, then that's up to you. I wouldn't advocate for that, but you can advocate for that. What I would ask you to advocate for is I would ask you to advocate for performance and accountability. What does that mean? Connect the dots between the amount of money that is spent on this problem and what you believe the outcome should be. You may believe that the outcome should be the creation of more affordable housing. We spent all this money, we didn't get more affordable housing. I'm fine with that. It's not what I would pick. I would pick, we've spent all this money, we employ all these people, we give hundreds of millions of dollars in federal and state and local money to providers who are not reducing the number of people living on the streets who are suffering and dying. That's what you have to do. And listen, here's one of the tricks that elected officials use. They said, but we're doing everything we can. What should we do? The responsible answer of a citizen is, I'm not the one who's elected. You are. I am holding you accountable for the public money that goes into a cesspool that doesn't produce results. I am going to hold you accountable for results. So you need to collect good data. You need to demand performance, pay for performance, and you need to demand outcomes and accountability. Thank you very much.
Let's give our panelists a round of applause, please.
On behalf of American Public Square, we would like to present our moderator and each of our panelists with an engraved civility bell. We hope these come in handy as you seek to engage in civil, fact-based conversations at home, at work, and in the community.
Thank you, Kira. Real quick, on behalf of American Public Square, I'm Tricia Maxfield, Program Director. We wanted to take a moment to steal some of the spotlight from these fantastic students. Thank each of our esteemed panelists, our fantastic moderator, Chris Green, our audio visual team from Lively, the entire team from American Public Square who worked on this year-long project, all of our teacher partners that worked with us. Tomorrow you're going to receive an email. Please answer it. Those questions help us to know what kind of impact our programming is having on the community. And we're involved in a special study right now about social cohesion in communities, so we would really appreciate that. You needed to take it before the program and then take the one that follows up tomorrow so that we have both of those. Thank you very much for that. Real quick, thank you to the students who are absolutely fantastic. If you're experiencing a feeling that you're not sure what that is, you haven't had it in a while, it's called hope. And these students will bring it to you because they're ready to take the world by the tail and do something really great. So on behalf of APS student ambassadors, what we hope for you is 3 things from our year-long program: that you ignited a desire to engage in your communities, and you heard a request from many of these folks to do that; that you gained better communication skills to talk to each other and others in a more productive way; and finally, that you feel a sense of belonging in the APS community, in the Kansas City community, in those communities where you may play, pray, learn, work, right? You belong and you have a place, so take it. Real quick, what everybody in the room hopes for you is that you'll continue to engage with sources that challenge your position and courageously exercise that civility muscle. These folks did that tonight. Really takes a lot of courage to get up and share your thoughts and opinions. If you have pencils and papers, we'll have students at the doors to collect them, and we sure would like to do that. The final word tonight goes to one of our student ambassadors from this year. We were really privileged to have Kira, a foreign exchange student from Belton High, as part of our cohort. She's going to end the night.
Good evening. My name is Kira, and I'm an exchange student from Ukraine, and I'm also an American Public Square ambassador. This year, I've had an amazing opportunity to live in this country and to experience American democracy, politics, and civil society from up close. I've seen how much this country values freedom of speech. However, I've also noticed how difficult it can be for people to truly hear one another. We talk a lot about our rights, but democracy is not just about having voice. It is about choosing to use it thoughtfully. It is about our willingness to engage in open, respectful, and honest conversations. Because discourse is what strengthens our democracy, what helps us navigate through our differences, build stronger communities, and find common ground. And as an American Public Square ambassador, I've had a chance to do just that, to step outside of my comfort zone and talk to people who see this world differently than I do. And here's what I've learned. We don't have to always see eye to eye in order to understand each other. Moreover, true growth and change happen when we listen, especially when it's uncomfortable. Our panel tonight was not about changing minds. It is about opening them, about building understanding, collaboration, respect, and hopefully solutions. However, I've seen the opposite at a town hall meeting with a congressman in Belton. The room that was filled with passionate voices quickly turned into shouting and chaos because people were not listening to each other. They were not trying to understand the other side. They were simply trying to be louder than the person next to them. And the opportunity to make change turned into division and frustration. This experience made me realize that democracy cannot survive without respectful discourse. It needs our willingness to listen, it needs respect, and it needs understanding. Coming from Ukraine, I've seen how much democracy matters to people. As Ukrainians, we're not just fighting for our land, but we're fighting for our right to speak, to be heard, and to change our own future. Democracy is something that we so easily take for granted. However, it is truly worth fighting for because it is our foundation for freedom and change. However, democracy is not just about system of government. It is a responsibility. It is our choice to engage and to stay curious in those hard conversations. That's why I believe that what American Public Square does is so powerful. They teach us students how to lead those important conversations, how to disagree with kindness, how to speak with intention, and how to listen, not to just reply, but to understand. So, in the world that so often feels divided, let's commit to listening, understanding, and engaging in those hard conversations. Because together, we can build a future where democracy thrives and every voice truly matters. Thank you, and thank you so much for coming to our panel.